Dr. Natalie Marks, and welcome back to another Quick Cup of Knowledge. Joining me today is Dr. Kelly Ballantyne, a veterinary behaviorist and owner of Insight Animal Behavior Services in Chicago. Thanks so much for joining us today, Kelly.
Thanks so much for having me here.
Yeah, I want to jump right into, I think, an area of medicine that a lot of general practitioners struggle with, which is some of the puppy behaviors, and are they normal or abnormal? Right. So let's jump into, a puppy comes into an exam room and we're seeing it for the first time. What are behaviors that you would consider as normal puppy behaviors, whether we're witnessing them or the owner is telling us that? And what would trigger kind of a warning light to go off that maybe this isn't normal puppy behavior?
Yeah, that's a great question. So in terms of normal puppy behavior, I mean, if you're seeing a puppy between 8 to 16 weeks of age, they're still in their socialization period. So what we should be seeing is lots of interest in interacting with you and exploring the environment. So they should be readily walking up to you, sniffing your feet, and walking around and sniffing the exam room environment. More abnormal or atypical behavior in that situation would be a puppy that's maybe hiding under the bench when you walk into the exam room. So if we have, a decrease in exploration, if we have a puppy that's avoiding us, certainly aggression in a puppy of that age is really atypical. So if we have a puppy that's growling, snapping, or biting at us in the exam room or during manipulations, those would all be cause for concern. And then a recent study, well, actually this is now almost 10 years old, so not so recent. They looked at puppy behavior in the veterinary clinic, and one of the things that they saw was that puppies that panted across multiple contexts, so like on the floor of the exam room, on the exam room table, or during manipulations, those tended to be the outliers. Like most of the puppies didn't pant in the exam room because we have a nice climate-controlled area. So if they're panting and they're not recovering really well from that, that could be a red flag.
And not only those signs of potential reactivity, right, but we also can start to see signs of anxiety, right?
Yes,
even
absolutely.
In young puppies. And what does that look like?
Yeah, so, we humans are really good at noticing kind of the obvious ones, like lots of whining or vocalization. What we want to look out for are those subtle signs. So ears being pulled back, lip licking, really big wide eyes where you can see the whites of their eyes, dilated pupils, and just overall body tension would be signs of anxiety that I'd be looking for.
And I know one of the hardest anxieties to treat is separation anxiety, right? And so you have a new client that comes in, maybe it's their first puppy ever.
Yeah.
What are some pearls that you can give to GPs to help teach those clients ways to try and avoid going down that road to separation anxiety?
Yeah.
Are there some tips you can give them to start getting their puppy used to being separated?
Yeah, so I think, starting in small steps. So maybe, putting the puppy in its pen or its crate, giving it something to keep it occupied, such as like an easy feeder toy or a Kong with a little bit of peanut butter smeared inside. Just leaving them in there for a few minutes while you sit right nearby. And then gradually working on like maybe sitting further away from the puppy or occasionally going out of sight of the crate before you advance to, okay, puppy, you're in the crate and I'm out of the house for 8 hours. That's a little bit too hard to adapt to.
That's pretty dramatic.
Yeah.
But it happens.
It happens, absolutely. Yeah. People go to work. So.
Yeah. Maybe we can just I'll stop working.
Yes,
and then we won't have to worry about it. But let's go back to reactivity, because I think that's an area, it's obviously very concerning for pet parents.
Yes.
It's concerning for us from a liability perspective, right? But also we know that dog doesn't feel good, right, when they're reactive. So when we're dealing with clients, I think a lot of veterinarians struggle with behavior because we maybe didn't get a lot of training in it, and it's a hard conversation to have. How do you go about talking to clients about reactivity? Because nobody wants to tell their pet parent that a new puppy is showing signs of what could be a lifelong journey of training, right? And working with them. How do you start that conversation?
Yeah. So, I mean, I usually try to ease into it and just say, listen, there are a few different areas of concern here where your puppy isn't behaving as we would normally expect. And we know at this point that puppies don't grow out of those behaviors, so they're not going to just get better with time. We're going to have the best chances of helping them to be a really great pet if we start introducing some interventions as early as possible.
Those are some great tips.
Thanks.
So if we're working with that client's on board.
Yes.
They're like, I'm committed to this puppy
Yep.
and I want to work from day one.
Mm-hmm.
So you were talking about some things that we could start immediately in our practice to help. Can you share some of those tips or recommendations?
Yeah, absolutely. So some really quick, simple things to do are to think about the management of that puppy. So do we maybe have a puppy that is vocalizing a lot when home by itself? Can we limit the amount of time that they're home by themselves while we get them acclimated to a crate? If we have a situation like we have a puppy that is maybe resource guarding, so growling or snapping when people approach it when it has, a yummy, delicious chew, maybe giving them time that they can enjoy that chew when they're on their own and not try to attempt to take that away from them while we work on teaching them that trading up items to us is associated with good things. So we can give them treats for trading, maybe a less valuable toy for that dog.
And are there supplements or other strategies that we can recommend? I know you mentioned like an Adaptal Collar.
Yeah. So an Adaptal Collar is a pretty great idea because it's easy. You just put it in place. You get to forget about it for about 4 weeks. And there is some really interesting research that shows that puppies that wore Adaptal collars compared to puppies that wore placebo collars were less fearful. They were more likely to play with other puppies, and they were more likely to hang out by other puppies during puppy socialization classes. So it's a good idea. It's a nice thing to just put into your puppy pack, and the client doesn't really have to do too much aside from put it on their dog. Some other supplements can be helpful too, like Angzitane or Zilkine. Those are things that usually take effect pretty quickly. It might help to reduce the stress and anxiety of that puppy within, a couple of weeks.
Do you ever use nutrition to work on behavior cases? Do you find value in that, or is that something that's just a very small piece of everything that you're doing?
Well, I think it could absolutely be a part of, the overall picture. And I even think about things like when it comes to house soiling, sometimes that is based on nutrition. Like we might have a pet owner that unknowingly is overfeeding their puppy, and then we have a puppy that is pooping in the house because they're getting too many calories in. There are some diets that are supplemented with ingredients that can help to reduce anxiety, so sometimes we'll use those, but I usually reach for those more for my adult patients.
Wonderful. Yeah. So we have a puppy, we've identified some of these, what we would consider abnormal behaviors.
Mm-hmm.
We've talked to the client's on board, we've suggested some of these tips. You see that client back in a few weeks for boosters and they're frustrated.
Yeah.
It's not getting better. In fact, we might be hearing things that it's getting worse.
Mm-hmm.
Talk about the relationship between having that client then see a veterinary behaviorist, and how does that all work together? How do we partner best with other of your colleagues to really help that client? That patient?
Yeah. So, I think a referral is, it's always good to consider a referral if the problem is continuing to get worse despite your interventions, or if you are noticing that human-animal bond is fracturing, clients getting really, really frustrated. So there's a lot of ways that general practitioners can work with veterinary behaviorists. So if you're lucky enough to have one in your area, of course, you can establish a relationship with them that way and refer cases. But a lot of us veterinary behaviorists will also offer vet-to-vet consultation. So if your client can't come in to see us directly, you can schedule an appointment with the veterinary behaviorist to get some advice on how to help these clients continue to navigate this life with this puppy or dog or cat.
That's wonderful. So we're running out of time, and I know we could talk about this for days.
For sure.
But I want to, for the newer grads who maybe haven't worked closely with veterinary behaviorists and they want to be transparent and give some expectations to their clients, what does a consult look like with a veterinary behaviorist, and what should they be giving expectations to their client about time and kind of the journey that they take with you?
Yeah. So the length of the consultation is going to vary from vet behaviorist to vet behaviorist, but usually people can expect to be spending at least an hour talking about the behavioral issue with the veterinary behaviorist. During those consultations, we're usually providing them recommendations on management, usually behavior therapy, and potentially even medications. And then because behavior change is a process rather than an event, there's also a lot of follow-up. So most dogs and cats don't just need one appointment. They usually need to follow up with that vet behaviorist on a fairly regular basis until the behavior is stabilized.
And what about that client actually taking videos at home?
Yes.
Do you recommend that?
Absolutely. So I just talked about that in my last hour of talks today. But yes, getting video of the home environment is extremely helpful. It often gives us a lot of answers that we wouldn't even necessarily get on a lengthy behavior questionnaire. So, and when we want to get videos of behavior sometimes, usually it's more helpful to get video of what the dog or cat's behavior looks normally in the environment, rather than trying to provoke, let's say, an aggressive encounter. So yeah, so video is helpful, but we have some specific guidelines on what we want.
Of course. Well, Kelly, thank you so much for all of your great tips. I know a lot of GPs will feel a lot better looking in their puppy exams and how to communicate better with clients on abnormal behaviors and what our resources are to help them have that great human-animal bond. So thank you again for all your knowledge. We really appreciate you joining us.
Thank you, Natalie.